Across Erie County, thousands of people are fighting quiet battles with mental health, addiction, poverty, and trauma. Every day someone needs support. Every day someone steps up to give it. What if your work didn't happen behind a desk, but on the front lines of change? What if you could be the lifeline that keeps someone in their home, out of the hospital, and on the path to recovery? This is Assertive Community Treatment, where purposeful careers impact lives.
Assertive Community Treatment, or ACT, is an intensive, team-based program that serves adults with serious and persistent mental illness. ACT brings treatment to the person wherever they are. It's treatment without walls. ACT supports individuals who typically aren't able to be successful in more traditional office-based care. They may have multiple inpatient hospitalizations, they may use a lot of crisis services, they may have state hospital admissions, and they might have involvement with the legal system. ACT is really a one-stop shop for care. The person can receive all of their behavioral health services from one team at the frequency that they need and at the places where they are. ACT will work with the individual to really create their own person-centered, individualized treatment plan. And that includes the goals that that individual wants to work on, as well as the frequency of contact. The team reevaluates the treatment plan with the individual as their goals progress and change so that they're supporting the individual with their treatment needs. ACT is built around a multidisciplinary team. With small caseloads and frequent touchpoints, ACT teams form lasting, supportive relationships. The goal? Keeping people in their homes, connected, and thriving. Individuals receiving ACT typically require ongoing responsive support, including expanded contact, not just during the daytime, but into the evenings and on the weekend. They operate an after-hours crisis on-call system where the on-call staff responds directly by phone or face-to-face to help support that individual and then act on their behalf with any emergency personnel who might be involved. And then we'll provide an update to the team the next day so that they can follow up on any needed interventions. There are several key roles within the ACT team, such as peer specialists, case managers, and others, often require a bachelor's degree or a high school diploma, while other roles on the team, such as the mental health therapist, team leader, nurse, and doctor, require advanced education. The team leader is master's prepared and has designated clinical and administrative duties. They provide clinical services to individuals, they provide supervision to members of the team. The psychiatrist provides clinical and crisis services and monitors the individual's clinical status. They oversee physical health needs and they prescribe the individual's psychiatric medications. The team may have a rehabilitation or vocational specialist with a bachelor's degree, and they typically help with rehab counseling. They can assist with activities of daily living training and support. The peer specialist is certified and provides peer support services. They disclose their own personal lived experience as the person who is or has received behavioral health treatment. ACT has mental health professionals who provide individual and group therapy. They are clinically trained and have a master's degree. The team is required to have a certain number of master's prepared clinicians depending on the number of individuals served. The team may also employ other mental health paraprofessional type positions who may have a bachelor's degree or a high school diploma with behavioral health treatment experience. They may have functions such as case management, housing linkage, or forensic support services. The registered nurse on the team provides medication monitoring and education. The substance use counselor typically has a master's degree as well as a type of substance use addictions certification. They support the individuals on the team who have both mental health and co-occurring treatment needs. There's typically also a person who serves as the program assistant. They're responsible for the day-to-day scheduling, operations of the program, answering the phone, and completing necessary paperwork. Assertive Community Treatment is a powerful launching pad for early career professionals and a fulfilling path for seasoned clinicians. Many begin as case managers, vocational specialists, or substance use specialists, and grow into roles like team leader and mental health therapist. This is where meaningful careers are built and lives are transformed. An ACT staff person is someone who wants to be part of a team. They are willing to share their knowledge and expertise with their team, as well as learn from other disciplines on the team. They understand the importance of involving the individual in their treatment planning, and they're able to pivot to address any of the emergent needs of that individual. A person who works on ACT truly believes that recovery is possible, especially for those individuals who have the highest behavioral health needs and have tried other services. It just takes a team of dedicated, knowledgeable, experienced, and creative individuals to walk alongside them.
People don't choose careers in human services to sit on the sidelines. They choose it to make a difference. Assertive Community Treatment needs compassionate, dedicated professionals, people like you, ready to meet individuals where they are and walk with them towards stability, dignity, and hope. Every life change starts with one decision. If you're ready to make a difference for your community and for yourself, this is where it begins.